Member of United States Congress from this area. Thank you all for joining us at the Caridad Center. Let me tell you who's here with me. Let's see, we got Laura Callis, who is the CEO, and we got Connie Berry and Sanjay Sharma, who are board members, and we have Jessica Lavin, who's Director of Communications. Oh, you're there. And we have a sign holder who refused to identify himself.
Shahid Freeman.
Well, we go back. We know I know these people for a lot of years, isn't it? Something from another life. So, for the federal 2022 budget, each member of Congress was permitted to submit a discrete number of requests for money, for program money, or infrastructure money for local nonprofits. Not all members did, but I did. After many meetings and input from stakeholders, I am very pleased, as I'm joined with these folks at Caridad, to announce funding for a very special program that has a significant impact on the quality of life in Palm Beach County. And listen, if the past 2 years has taught us anything, it's how important it is to keep ourselves healthy and our neighbors healthy. Healthy people go to work, they pay taxes, they stay out of emergency rooms. Healthy children thrive, they go to school, they miss less school. So access to quality, affordable care is part of a mission to build a better America. And that's why I am so pleased that I was able to secure for this center, don't cry, $1.1 million, actually a little bit more than that, $1.136,000 for Caridad. And this is the largest freestanding health clinic in the county, one of the largest in the country. They serve thousands of people. They do medical, dental, vision care. I'll let Laura, who I'm going to introduce, explain, say what you do. The money's going to go to upgrade their infrastructure, purchase more medical equipment. With that, again, thank you, Caridad, for all you do. And this is Laura Callis, the CEO.
Thank you. Good morning. As many of you know, Caridad Center is the largest free clinic in the state of Florida. Our volunteer doctors provide free medical, dental, vision, social services, and mental and behavioral health care to the uninsured working members of our community who otherwise can't afford access to care. This appropriation is going to provide key upgrades, as Lois mentioned, such as a roof, air conditioning, but also much more exciting things such as digital panoramic machines for our dental clinic, state-of-the-art vision equipment for our renowned eye clinic, one of the only free eye clinics in the county. We are so excited also, it's going to provide a mobile health clinic that we will be able to use to reach out to communities who cannot access us through lack of transportation. So we are thrilled to accept this appropriation. And on behalf of my board of directors, Caridad staff, our volunteers, and the thousands of people who depend on us for care, we thank you so much. We thank you and your team and everyone who supported this gift to us. We promise to be good stewards of your trust, and we continue to provide access to care and reduce racial disparities of health in Palm Beach County. Thank you so much.
Oh, that's great. Oh, you're welcome. Thank you. Okay. Short and sweet. Anybody have any questions? If not, we're going to let you.
Well, Laura, I would like
Yeah.
to ask you, what are the biggest things that you really needed that you'll be getting with this money? What were you lacking? You kind of listed a few things, but what were the main things that are going to make this a huge difference when people walk through these doors?
Well, in addition just to the equipment needs that we have, just to be able to provide that care, the infrastructure upgrades are critical. These are expenses that we will be having to budget for, and we are a charity. So as a 501c3, we depend on donated dollars and grants to be able to provide care. And it's very difficult to get that kind of support, that kind of capital support for these upgrades. So the money that we will be able to have now to do that, we can be able to put into more care for our community, and so that we're thrilled. That
Can you repeat
Sure.
repeat for her the equipment and the infrastructure improvements? Yeah.
yes.
So
So-
why don't you repeat it for her so she knows?
Okay, yes, sure. This infrastructure upgrade is going to give us a new roof, new air conditioning, new expanded storage facilities. We're going to also be able to buy digital panoramic machines in our dental clinic, as well as handheld machines and other oral surgery tools that we'll be able to do in our dental clinic, as well as lasers for our vision clinic, which we're very excited about. There's going to be a lot of state-of-the-art tools that we'll be able to use for that vision clinic as well. So we're thrilled. It's money that we'll be able to put into now. The money we don't have to spend on those capital expenses, we'll be able to put into our mission and reach out to more people in the community. The mobile van that we're looking at is exciting. We'll have a dental chair and an exam room, and we'll be able to go out into those hardest to serve communities who can't access us because of lack of transportation.
And when are you hoping to have this all complete?
And within a year, how much time do we have? So
They have to fill out some paperwork. They'll be coordinating with the agency that will be dispersing the money, and hopefully it'll be sooner than later.
yes, we're ready to go.
Yeah.
Yes, we're ready to go. We're ready to hit the ground running. Yeah.
Thank you.
Anybody else?
Thanks.
All right, thank you very much for being here, everybody.